Welcome to this edition of Research Connection. Joining me today is Dr. John Bonagura. Thanks for joining me.
Thank you. It's great to be here today.
Yeah. So tell us a little bit about yourself.
Well, I'm a long-term veterinarian, so I've practiced veterinary medicine for over 40 years. I'm board certified in cardiology, which is my main practice, but also internal medicine. And over the years, I've spent most of my career at Ohio State University. I came there from there in January, end of January. But I've also spent 5 years in a professorship at the University of Missouri in Columbia and a year as a research fellow at Edinburgh University in Scotland. But most of my career has been spent at Ohio State, but it's very exciting to be here. I know quite a lot of faculty members here, and also I'm a native North Carolinian, so I'm actually reconnecting with some cousins and other relatives. That's been great.
Very nice.
Yeah. So in terms of my research career, it's changed. I've been really in academics for over 40 years. And I've done a variety of things, but mostly clinically based. My major interest certainly today would be in clinically based research, and the tool that I typically use is cardiac ultrasound. Echocardiography would be another term. Echocardiography is a way that you can both create diagnoses but also quantify heart and vascular function. And so my publications have mainly centered on using echocardiography for those two things. For example, in the clinic, it would be diagnosing unusual conditions or applying ultrasound. I was one of the first people, just based on my age, to apply echocardiography in veterinary medicine. So I started with simple linear M modes and moved on to the current technologies. But I've also used echocardiography and vascular ultrasound in the research laboratory, biomedical research with pigs in terms of vascular biology. When I was at Missouri, I have quite a bit of experience imaging rodents. There are some very high frequency instruments that are made specifically for imaging the hearts and non-invasive assessment of the vascular and cardiac systems in mice, and I have some experience with those. So that's been most of my career. I certainly have done a number of pharmaceutical studies. Enalapril, one of the early ACE inhibitors used in veterinary medicine. I've been involved with a number of the inotropic studies, some that have been successful, some that have not, including a very large study of a NEP inhibitor that I think had a great deal of promise, but certainly didn't pan out once it was looked at critically. So, as in most research careers, there are successes and efforts that don't go unrewarded, but are maybe not as successful as you've hoped. I think currently what I would probably want to do here in my new position would be to be a collaborative researcher or somebody who might help train others in using ultrasound technology in cardiovascular assessment. I'm mainly brought here to support clinical activities and teaching, so almost all of my effort is devoted towards that, but I still have a real interest in collaborative research as well as clinical research. So we actually have a clinical research meeting today, and there's an active group here in the Terry Center. And in addition, here in the BPC, there are a number of people who have some interest in cardiac and vascular studies, and it might be that I could collaborate with some of these folks in the future. So it's been a very exciting environment here, and I've enjoyed it thus far.
That's fantastic. We're happy to have you.
Thank you.
Thank you.
Okay, is that enough?